Oh, there we go. So the complex nature of public health nursing makes it really challenging to specifically define the role of the registered nurse in public health. And in fact, public health nursing role is continuously evolving in order to meet the changing needs of the populations being served. The role is so dynamic, in fact, that it's often been referred to as a work in progress. And within St. John's alone, the role of the registered nurse in public health can and does vary depending on the area of the city you work in. One nurse I spoke to said, "My day-to-day work is very different than my colleague who works less than 10 kilometers away." And this fact, I know, can be applied provincially as well. The truth is, public health nurses have thousands of contacts with the public every year, yet our role is still quite vague to the general public and to our healthcare colleagues. We're often hidden in comparison to, say, nurses working in a more disease-specific model of health service delivery, which is quite visible and familiar to the public. By the end of the presentation today, I'm hoping you will have an understanding of the distinct yet diverse role that public health nurses play in our healthcare system. I'd like to start with some of the foundations of public health and public health nursing practice. Then I'll attempt to illustrate public health nursing by breaking down the presentation into the 6 key areas where public health nurses play a role. And these are health promotion, health protection, disease and injury prevention, health surveillance, population health assessment, and emergency preparedness and response. And to paint the picture in the best way I can, I'm going to use some examples and real stories from actual registered nurses working in public health. And again, I want to thank them for their participation in this presentation. So first, I want to make an important distinction between public health and public health nursing. So public health, quite simply, is defined as the organized efforts of different disciplines in society to keep people healthy and prevent injury, illness, and premature death. It encompasses many different programs and different services and policies, all with a shared responsibility to protect the population. Public health nursing is one such discipline within that larger institution of public health. Public health nursing is the synthesis of science and nursing theory. So essentially, it's a mixture of public health science, primary health care, nursing science, and social science. Public health nursing has often been described as both a science and an art. Many elements of the role are quite scientific and tangible, such as responding to epidemiological evidence and patterns, using vital statistics and demographics to plan programming, and preventing disease through immunization programs. Other aspects are much more difficult to quantify, such as completing holistic assessments of families, taking time to build trusting and caring relationships with clients, applying a health equity lens to everyday interventions, and establishing mutual trust with individuals and families and advocating for social justice. These are the things that are the art of public health nursing. With respect to practicing public health nursing, all nurses in this province are trained to understand and uphold the code of ethics and our professional standards of practice. We are all very familiar with that. But in addition to these, public health nursing is also guided by a number of other significant documents, which together can be seen to make up a bit of a syllabus for public health nursing practice in Canada. So these are the core competencies for public health in Canada, and those were developed by the Public Health Agency of Canada, the Canadian Community Health Nursing Standards of Practice, and the Public Health Nursing Discipline-Specific Competencies, both authored by the Community Health Nurses of Canada, as well as the Roles and Activities document, and that one was authored by the Canadian Public Health Association in conjunction with Community Health Nurses of Canada. And that was a lot of Canadas. A few well-known landmark documents contribute to the theoretical foundation of public health nursing practice. So the Lalonde Report of 1974, which was a new perspective on the health of Canadians, identified 4 determinants of health, and those were human biology, lifestyle, healthcare organization, and environment. Then came the EP Report in 1986, Achieving Health for All, and that one taught us that reducing inequities and increasing prevention and enhancing coping skills were also needed to achieve health. Then came the World Health Organization's Ottawa Charter for Health Promotion in 2006, which has been considered a seminal document and a template for health promotion since its inception. And that document laid out 5 key strategies to promote like a joined-up societal-wide approach to effective health promotion, and we still use these today. And they are to build healthy public policy, create supportive environments, strengthen community action, develop personal skills, and reorient health services. And today, in 2021, with thanks to the Public Health Agency of Canada, we know that there are indeed 12 social determinants of health in their day-to-day work. They understand that the social determinants can predict the health of individuals and populations. So you can see there the 12 social determinants of health are income and social status, employment and working conditions, education, healthy childhood development, physical environments, social supports and coping skills, healthy behaviors, access to health services, biology, genetics, gender, culture, race, and racism. So the social determinants are defined by the World Health Organization as the conditions in and under which people are born, grow, work, and live. On an individual level, the social determinants such as housing, employment status, and working conditions impact people's daily lives and can determine their risk of illness and ability to access health care. At a collective or societal level, the inequities between groups of people shape how society is organized, often into hierarchies based on factors such as income, gender, and race. Where people are in that social hierarchy ultimately affects their health. Because of the unfair social arrangements, unnecessary inequalities in health status are created. Reducing health inequalities means helping to give everyone the same opportunities to be healthy, no matter who they are or where they live. It's not enough just to know what the social determinants of health are. Public health nurses have to truly understand them because they are expected to practice in such a way that diminishes the perpetuation of health inequities that currently exist. So as mentioned in the outline, I'm going to organize my explanation of the role of the registered nurse in public health by describing the key roles of the public health nurse. And again, these are health promotion, health protection, disease and injury prevention, health surveillance, population health assessment, and emergency preparedness and response. And furthermore, I'm going to provide those real-life specific examples from my colleagues in public health here in Eastern Health to further illustrate that role in action. And I just want to note that it does feel a little artificial to fragment the components of public health nursing in this way, because more often than not, the same public health nurse performs many and all of these roles in his or her job daily. So breaking it down in the manner that I'm about to do is just an attempt at simplifying the content. There will be aspects of public health nursing that I cannot possibly cover today due to the limited time we have together. So I will apologize in advance to my public health nursing colleagues for anything that might feel missed in the presentation. So the first role I'm going to cover is health promotion, and every contact that a public health nurse has with a client is an opportunity to promote health, regardless of the setting. So we're talking about students in school, expecting mothers, new Canadians, new families, and a host of others in between. Public health nurses employ a community or population-based approach to health promotion, where the goal really is to shift the distribution of risk factors and diseases across entire populations. But this approach is often complemented by more targeted approaches, often focusing on higher risk or more vulnerable clients. So Sherry Hopkins is a public health nurse who specializes in high school sexual health, and health promotion is a huge part of what she does. She learned early on that creating access and a supportive environment was paramount. Referring to the students, she says, I embedded myself into their world and I learned how to speak their language. She goes to the school 2 mornings a month and she stays there each day for as long as she's needed. She offers confidential drop-in services. Students will text her directly if they want to arrange an appointment with her. Technology, she has learned, is critical in her interaction with the students. Emails and phone calls or going through the office for an appointment was just not meeting the student's needs. Public health nurses must possess a variety of health promotion skills, and of these, communication skills are considered to be one of the most important. In her role, Sherry strives to be non-judgmental, relevant, and relatable. Often, she finds that she has to listen more than she speaks. There are many times when her jaw just wants to hit the floor, but as a public health nurse, she has trained herself to listen with care, empathy, and respect for the students. While listening, she assesses the knowledge, attitudes, values, beliefs, and the maturity of the students, and then she'll adapt her plan of care based on her findings. Setting and maintaining boundaries, of course, is also critical during the counseling relationship that Sherry has with the student, and there has been times when professional responsibility has dictated a connection with the student's parent when safety has become an issue. So in this role, Sherry provides both health education and clinical services. She collaborates with 2 nurse practitioners to offer STI screening, treatment of sexually transmitted and blood-borne infections, and pregnancy testing. In early days, Sherry's health education often focused on what she thought the students needed, so information on STIs, how to put on a condom, etc., etc. But over time, she learned that what she was doing was merely providing information. She realized that providing the information she thought they needed was a rather passive concept. Her talks now focus on assessed need that would have been identified through her interactions with the students. So she covers things such as consensual sex, owning your own body, healthy relationships, gender diversity, and sexuality and gender. Empowerment and harm reduction are also at the core of her work. She says, it's not don't do this and don't do that. It's let's talk about how you can stay safe and make healthy choices. Sherry has a lot of support from other public health nursing colleagues who are sexual health promotion consultants. Their expertise in this area helps to support sexual health programming provided by Sherry and many other public health nurses at Eastern Health. So the second role I will cover is health protection, and public health nurses work with individuals and families to create or maintain safe environments where people live, work, and play. And this often requires the collaboration of many different services and governmental agencies. Stephanie Matthews is a public health nurse in St. John's who works out of a community center. She frequently works with vulnerable populations in collaboration with many partners, including the Department of Children, Seniors, and Social Development. In Stephanie's role as a public health nurse, she supports clients in order to ensure they are able to access the services they need to safely raise their children. One of her clients was a sex trade worker whose 5 children were in care. Through the ongoing collaborative support from Stephanie, the nurse practitioner, and the social worker, the client is now an active member of the community center, raising 3 of her children in safe housing near the community center. In another example, Stephanie, in her public health nursing role at the community center, was both a catalyst and a collaborator when it came to protecting the health of her client. Her client was a 23-year-old woman who was an immigrant to Canada with 4 children. She did not complete her high school education and was married at the age of 18. After a number of years of having Stephanie as her public health nurse, she confided that she wanted birth control, but her husband was not in agreement. She lacked the know-how and the resources to access this service on her own. Stephanie assisted by referring her to a gynecologist and, in collaboration with a social worker, arranged transportation via taxi to have an IUD inserted. Because the client lacked the confidence to go to the appointment alone, Stephanie met this client at the clinic and went to the appointment with her. At the center of this encounter was safe, compassionate, competent care. Care that was culturally sensitive, non-judgmental between both a client and a trusted caregiver. And that's what public health nurses do. Home visiting has been foundational to the role of registered nurses in public health. It is critical to our role in health protection. It allows the nurse to engage with the children in a home, observe family dynamics, assess the home environment and the broader neighborhood, and potentially gain a deeper understanding of the family's strengths and needs. Debbie St. Croix, a nurse in a rural area of Eastern Health, describes important information she learned about a family while home visiting. Information she would likely not have known to help with had their encounters been strictly clinic visits. So a new mom and dad and their infant were living in a home with bare wooden floors, open insulation on some of the walls, and no proper running water or kitchen facility. There was an open staircase with a concrete floor at the bottom. Recognizing the risks to the baby and the entire family, Debbie collaborated with a social worker to have some repairs made on the home. The wooden floors were the last of the repairs to be taken care of, and Debbie recognized that this was beginning to impact the child's growth and development, as the parents refrained from putting the child down on the bare wooden floor for tummy time. In the interim, Debbie had a large rug donated so that the baby could engage in the gross motor activity required for normal development. And eventually, her collaborative efforts with the Department of Children, Seniors, and Social Development resulted in the family moving into a more suitable home. Disease and injury prevention is almost like a sister term to health promotion and is a large part of the role of the registered nurse in public health. It involves taking measures to reduce risk factors for disease and injury, or taking measures to reduce the impact or progression of disease and injury. So public health nurses rely heavily on epidemiological principles and knowledge of both communicable and non-communicable disease processes in order to manage and control them. Take pertussis, or whooping cough, as an example. In recent years, health jurisdictions nationally begin to note an increase in the incidence of pertussis, especially in very young infants. Pertussis, which is fairly well controlled in the general population, is particularly dangerous for infants, since under 2 months of age they are unvaccinated. So in response to the alarming trend of infant morbidity and mortality from periodic pertussis outbreaks in Canada, public health nurses in Newfoundland adopted the national and provincial recommendations to begin immunizing pregnant women with a pertussis-containing vaccine. By providing mothers with the pertussis-containing vaccine during pregnancy, newborns are given protection from pertussis disease in the first few months of their life through the maternal antibodies. It is the role of the registered nurse in public health to help individuals and populations adopt health behaviors that reduce the likelihood of disease. Public health nurses build teaching, skill development, and knowledge translation into their plans of care for clients. Again, the prenatal period is an opportune time to affect health outcomes, not just for mom, but for baby as well. Cynthia Cadigan is a public health nurse who now works as a clinical nurse coordinator. However, when she carried a client caseload, she worked very closely with vulnerable prenatal clients. With her prenatal clients, Cynthia made a point to discuss the importance of safe food handling during pregnancy and the risks of foodborne illness to both mom and unborn baby. She emphasized that the risk is higher with certain foods. A public health nurse can be the primary resource for expectant moms, especially those within the vulnerable population. Nurses like Cynthia play a large role in non-communicable disease and injury prevention by supporting mental wellness for mothers, infants, and families. Public health nurses support the life course perspective and recognize that early biological and social circumstances, including early stressors and traumas, can interact over a lifetime to impact health and illness later in life. Discussing mental health with mothers and mothers-to-be and screening them for mood disorders was core to Cynthia's practice. When connecting with prenatal clients to offer them pertussis immunization, Cynthia took the opportunity to also discuss perinatal mental health and offer screening for depression. If concerns were noted, she would refer to the client to the appropriate services as needed. She would continue to follow her prenatal client through their pregnancy, in the postpartum period, and through the first years of baby's life. Continued case management enables clients to develop trust in public health nurses and allows nurses like Cynthia to continuously assess a family's well-being. Public health nurses will take a strengths-based approach to capacity building and will provide interventions in order to support parent-child relationships, enrich bonding and attachment, enhance opportunities for optimal child development, and ensure safety of the family. Health surveillance is also a huge part of what public health nurses do, and public health nurses apply surveillance data and trends to their everyday work. Lactation consultants, for example, who are registered nurses within public health, collect breastfeeding data, which includes infant feeding history post-discharge from hospital and in child health clinics at 2, 4, 6, 12, and 18 months. This provides the consultants with a rich database from which they can identify trends, note differences between geographical locations, and provide robust information to the organization and to the province. Data is also used to help inform decision-making and guide targeted interventions, such as the Bay Breastfeeds campaign, which came about in the last few years because lower breastfeeding initiation and duration rates were noted for the rural Avalon and Peninsula's part of the region. Andrea Doyle is a public health nurse who specializes in communicable disease control, and specifically sexual health. As a registered nurse in public health and now a nurse practitioner, she recently found herself heavily involved in managing a syphilis outbreak, which started with identifying data and trends. From close surveillance of data provided daily to Eastern Health's Communicable Disease Department from the Provincial Public Health Lab, it became apparent over the course of late 2014 and early 2015 that there was a dramatic increase in the number of syphilis cases, many of which were epidemiologically linked. An outbreak was declared. Andrea worked with another nurse colleague to track each case, including the month reported, staging, risk factors, and co-infection with HIV. They developed outbreak graphs to provide a visual of the situation, and they used social surveillance in the form of social networking analysis to determine the path of spread and key transmitters in the outbreak. Once the outbreak was declared, a control team was established. Andrea consulted and collaborated with multiple sectors of Eastern Health, including technology, communications, and health promotion. She worked with colleagues within the health region and at the provincial level to set clear clinical treatment and management guidelines. She built coalitions with community partners such as the AIDS Committee, St. John's Pride, Memorial University, and the College of the North Atlantic in order to increase access to testing clinics, to help with social marketing education and advertising. With each confirmed syphilis case, Andrea contacted the client's primary healthcare provider to advise of a positive screening result, and then arranged treatment and provided notification and contact tracing interviews with identified partners. Recognizing the syphilis outbreak as a priority for the CDC department, Andrea worked with her manager and her colleagues to shift and realign resources in their department in order to meet the demands of the interventions that were required to combat the outbreak. Sexual health clinics increased from 1 per week to 4 to 5 per week. With the additional resources, contacts of cases were identified, tested, and treated within days of being identified. And with this aggressive response and interventions, the numbers gradually decreased. As a registered nurse working in public health, you use what you know about the determinants of health and what you learn about communities you serve in order to plan the services you will provide. When dealing with unique and vulnerable sectors in particular, there is not a one-size-fits-all approach to assessment and services. There is no script or algorithm. Nancy Biles is a registered nurse working in public health. She works out of the Youth Services site in downtown St. John's. Although she has the same title as her colleagues all over the city, her day looks vastly different than most, based on the population of vulnerable youth that she works with. Nancy's method of assessing what her client needs is very different than the assessment her colleague 10 kilometers away might use. Nancy's general assessment of an individual client is to first observe their appearance and body language. So according to Nancy, cleanliness of teeth is huge and can tell you a lot about people's health. The condition of their hands and fingernails can usually tell you if they're employed. The way they are dressed, such as do they have symbols on their shirts, brand names, are their clothes clean, fitting, are they dressed appropriately for the weather, these all give her cues. While this isn't meant to stereotype at all, it gives you a starting point to see if what you are observing matches where they currently are in their health. Nancy will also assess whether or not they are involved and engaged in community programming. If they are, they usually have better health. She assesses if they have housing. Are they collecting income support? Are they employed? Are they a student? Have they been in foster care? Do they have positive relationships with family members? Are they social, or do they keep to themselves? Have they ever been to rehab? Have they finished a rehab program? Do they have a family doctor? Do they even have a phone? These are just some of the things she looks at to determine people's health. The plan of care for a client is all very individualized, using trauma-informed practice guidelines and with a harm reduction lens. Plans are not built on moral idealism and do not aim to eliminate behaviors and convert people. Plans are based on compassion and client input. They meet people where they are and offer practical alternatives aimed at minimizing the personal and social harms of behavior choices, rather than whether the behavior is right or wrong. As a registered nurse working in a harm reduction model, it is essential to continuously reflect on your own assumptions and on your professional responsibility. You have to fully accept the tenets of the harm reduction approach to maintain a genuine, caring relationship with your clients and understand needs through the eyes of the client. Health and social trends identified by Nancy and her colleagues at the center helps to inform the population-level programming that's offered there, which of course tends to change over time. Robin Connell, also a registered nurse working in public health, assesses her clientele of new Canadians in a very different way. She starts with the completion of a health history with all clients following their arrival in St. John's. Often, interpretation services are required. She reviews any medical papers, including immunization records they may have brought with them. In addition, she case conferences with providers at the primary health care clinic, co-located with her at the Refugee Health Collaborative Clinic, in order to determine if there is any communicable disease follow-up she can help with. She also works collaboratively with the settlement team at the Association for New Canadians. They are able to inform her of any concerns or other information from international organizations, such as the United Nations High Commission for Refugees and the International Organization of Migrants, that she may not be aware of. Once she gathers the necessary information, she has a second visit, a clinic visit, where she communicates to the client what public health nursing services she would like to offer them. So the public health nursing services might include immunization, seasonal influenza vaccination, TB screening and follow-up, school health services, prenatal and postnatal support, communicable disease follow-up, and other health promotion and injury prevention as identified. Of course, providing culturally relevant communication and culturally sensitive care is something that Robin has learned and honed over the years of working very closely with multicultural clients. Again, the trends that she and her partners note determine the programming, which again will change to meet the client's need. The final role to cover is emergency preparedness and response. Registered nurses working in public health must be prepared to respond directly to any public health crisis, from a community disease outbreak to a natural disaster, and yes, to the COVID-19 pandemic. The tenets of emergency preparedness are a necessary competency for a nurse working in public health, even though months, years, and even a lifetime might go by between having to deal with large-scale emergencies. Since the role is so diverse, it requires agility and strong clinical and critical thinking skills. I'd like to share Tracy Kane's story of being a registered nurse in public health, working away with her regular role, such as preschool health clinics, prenatal screening, postnatal home visiting, and immunizing when the COVID-19 crisis became real. So Tracy writes, on March 3rd, 2020, I was assessing a 4-year-old in preschool health check when I received an email requesting I visit a mother and son in their home to perform a nasopharyngeal swab for COVID-19 testing. Very quickly, a coworker and I had to familiarize ourselves with the policies and procedures around swabbing in the home. That was foreign to us. I continued to swab every couple of days as needed, along with my other responsibilities in the district. I experienced a sad, hard day and reality when I was notified that one of the earliest positive clients whom I had swabbed succumbed to the illness. On April 1st, I received notification of my redeployment to the CDC department and received 3 hours of training on contact tracing. April 2nd, my schedule was changed to 10 hours from 8-hour days and to evenings and weekends. My role changed to contact tracing and case follow-up during the first wave of this pandemic. I was introduced to multiple documentation and information systems. My role as public health nurse in the district was now halted. In May, the contact tracing and cases had decreased, and then I was handed the role of monitoring travelers into the province and surveillance of them, another form of documentation and monitoring system to adapt to. My last day of redeployment was May 22nd when I left CDC and returned back to my regular public health nursing job. While back in the office, fulfilling my role as a public health nurse, I was trying to catch up on schoolwork and immunizations. On June 15th, we diligently worked on a plan to operationalize a mass school immunization program over the summer months to catch up on school immunizations missed early in the pandemic. The mass immunization program clued up on July 10th. Through the fall, it was decided that the flu vaccine campaign would extend into the school setting, which involved quite a large commitment to planning and implementation in the 2 schools assigned to me. With the flu campaign this year came a new EMR documentation system, and that had its own set of challenges. Then came December, no time to gear down for Christmas in public health during a pandemic. On December 16th, I started training for administration of COVID-19 vaccine, and on December 17th, started providing the vaccine to Eastern Health staff. The most recent COVID-19 outbreak in February came very quickly upon us, and I was redeployed once again to CDC to assist wherever I was needed, case management, surveillance, and contact tracing mostly. The pandemic is unlike anything I have been through in my 25 years of nursing. There is and has been a lot of uncertainty, fear, and frustration, but as a team, we all came together and supported each other. Nurses have not physically worn hats on the job for many years, but being a public health nurse today, we certainly change our hats on a minute-to-minute, day-to-day, or week-to-week notice. This is what public health nursing is.